This is our assessment comparison analysis. I'm Catherine Blessing.
I'm Theisha Donaldson.
I'm Lauren Goodman.
I'm Taylor Heath.
I'm Maren Grime.
And I'm Jamie Tasiopoulos.
The two assessments that we compared for this assignment were the VB map and the ABLES assessment. The VB map is also known as the Verbal Behavior Milestones Assessment and Placement Program. It is an assessment tool used with individuals with autism spectrum disorder and other language delays. It can be used by clinicians, educators, parents, assessment teams, and anyone who supports the child. It is based on B.F. Skinner's analysis of verbal behavior, established developmental milestones, and research from the field of behavior analysis. There are 5 components that are included within the VB map.
So the VB map milestone assessment was created to help provide a sample of a child's existing verbal and related skills. The assessment contains 170 measurable learning and language milestones that involve 3 developmental levels, 0 to 18 months, 18 to 30 months, and 30 to 48 months. Skills that are assessed are tact, echoic, interverbal, listener responding, manned, motor imitation, social play, independent play, etc. So the defining key terms: tact is expressively labeling any of the 5 senses. Echoic is vocally repeating what another person says. Interverbal is responding to another person's sentence. For instance, if I were to say Mac and the person or client would say cheese. Listener responding is another person responds to someone else's verbal behavior. So if I were to say go get the pencil, they would respond by going and getting the pencil. And then a manned is a request. So the barriers assessment, according to Padilla and Akers 2021, focuses on both common learning and language acquisition barriers faced by children with ASD or other developmental disabilities, such as behavior problems and instructional control. Negative behaviors, escape and avoidance of instruction, absent or weak manned repertoire, tax, and imitation skills can be targeted in this assessment. There are 5 levels in the Likert scale: 0, which is no problem; 1, an occasional problem; 2, a moderate problem; 3, a persistent problem; and 4, severe problem. Being able to identify these behaviors can help professionals develop specific intervention strategies.
VB map transition assessment. You can identify if the client is making sufficient progress and has maintained the appropriate skills for transitioning to a less restrictive environment. This tool can help have a measurable way for a child's IEP, which is the Individualized Education Program, team make choices to be able to meet the child's educational needs. VB map task analysis and skills tracking, and VB map placement and IEP goals. The study by Padilla and Akers 2021 states that this assessment goes hand in hand with the milestone assessments and provides an even further breakdown of the skills within the milestone assessment. According to Padilla and Akers 2021, the curriculum placement and IEP goals help practitioners develop and design an inclusive intervention plan and specific targets based on individual results.
So the ABLES is an assessment of basic learning and language skills. The primary purpose of the ABLES is to assess and identify skills in language and communication, as well as critical academic learning, self-help, and motor areas. ABLES are recommended for individuals ages birth to 12 years old. The ABLES consists of a comprehensive review of 544 skills from 25 skill areas. The ABLES address a wide range of skills, including learning readiness skills and the distinction between various language functions. The ABLES allows for the optimization in communication, social interaction, and ongoing learning in everyday situations. The ABLES come along with several limitations, including the visual scoring grid used within the ABLES may be misleading in respect to scorers that are looking to interpret progress. Additionally, no data to suggest that the scores can be added together in a meaningful way, specifically in respect to tracking overall progress. There's no published data in respect to validity or reliability. Validity refers to the accuracy of a measure, and reliability refers to the consistency of a measure. Additionally, the assessment itself is notably long, And lastly, there is a lack of clear guidelines surrounding the use of reinforcement, which may lead to variability in the administration of this assessment.
Okay, so ABLE's measurement and data collection. So ABLE's primarily uses a direct measurement system. So direct measurement systems can be understood as recording behavior as it occurs, either in natural or contrived settings. Conversely, indirect measurement can be understood as when the behavior is not directly observed and conclusions are drawn from other behaviors or environmental events. While indirect measurement systems can be beneficial, they are not the primary measurement system utilized when using ABLE's. So ABLE's validity and reliability. So each skill has a maximum score that varies from one skill to the next, but the maximum score for any domain will either be a 2 or a 4. So for any skill with a maximum score of 2, the learner may score a 0, 1, or 2. For skills with a maximum score of 4, the child may score a 0, 1, 2, 3, or 4. From there, the data is then entered into the ABLE's R graph. So utility in selecting ABLE's assessment. So the ABLE's covers many skill domains, including cooperation and reinforcer effectiveness, visual performance, receptive language, so understanding the input of language. So basically that would be if I put 2 cards out in front of the table, one of a dog and one of a cat, and then were to say, touch the dog, and they touch the dog. Imitation, vocal imitation, requests, labeling, and interverbals. These domains are imperative when working with younger individuals who have been diagnosed with autism.
So for our scenario, we have Charlie is a 4-year-old girl who was diagnosed with autism spectrum disorder, also known as ASD, when she was 2 years old. At the age of 3, she started receiving ABA services. However, her parents are unsure of where to begin with speech therapy and occupational therapy. Although Charlie encounters difficulties with some sounds, she manages to make approximations for several words. She has been allotted 35 hours of ABA per week, which she receives at an ABA clinic Monday through Friday from 9 a.m. to 3 p.m. After reviewing the difference between ABLE's and the VB map, I want you to ask yourself the question, what kind of assessment is best for Charlie and why? VB map assessment for Charlie is the best assessment for her. Although both assessments focus on language and communication, the VB map has the early echoic skills assessment, also known as the EESA. This assessment is used to evaluate an individual's ability to repeat speech sounds. The EESA includes 5 groups of items. Group 1, vowels and diphthongs, which is a sound combination of 2 vowels in a single syllable word. So for an example, loud. Groups 2 and 3, early consonants and 2 and 3 syllable combinations, respectively. And groups 4 and 5, prosodic, which is relating to rhythm. Features of speech including pitch, loudness, and vowel duration. Charlie has the ability to make a variety of approximations, which is sounds that are close to the desired sound or word, but needs assistance with combinations of syllables to appropriately say the complete word. This is the main reason that the VB map assessment was chosen for Charlie's case, and we hope you enjoyed our presentation. Here are our references for our presentation. Thank you.